Hi, this is Dr. Gullberg, continuing our internal medicine series, lecture series. Today we're talking about acute myelogenous leukemia. Um, Obviously, in adults, acute leukemias are very, very serious. Our oncologists it's their bread and butter. We don't see really as much ALL, obviously, in adults. It's more of a pediatric disease. So I'm just going to talk a little about AML. AML accounts for about 1.2% of all cancer deaths. It's about 10,500 new cases per year in the U.S. It's fatal within weeks or months if it's not treated. Uh, we really don't know what causes it. There's about a 5-year survival rate of 15 to 70%, pretty variable. Recurrence rate of about 40%, which is pretty high. We treat it with chemotherapy. We treat it with bone marrow transplant. We can cure this disease with bone marrow transplant. And the classification system is the World Health Organization. Previously, we used the French American British, the FAB system for classification. So risk factors for acute myelogenous leukemia, where patients have a huge white count with a left shift, a lot of premature, premature cells, myelodysplastic syndrome, previous chemotherapy with alkylating agents, exposure to benzene or aromatic solvents, exposure to radiation, and then there are some genetic factors. There's different types of acute myelogenous leukemia, and these have different prognoses. There's different chemotherapeutic treatments. One example would be the acute promyelocytic leukemia, which is highly curative. Patients are older than 60, or if they have a very high LDH on diagnosis, these are poor prognostic markers. But AML patients have aura rods in the peripheral smear, so that's a diagnostic tip-off for AML. So this is just a couple of key points about acute leukemia. Hopefully that'll help you as you see a patient with a significant leukocytosis and has a new diagnosis. Thank you.